11th, 2025 at 1:30. And before I do, we have a new member on our committee. We have Nick Andrus, who just joined us on the county board. So welcome to Nick. Good luck. All right. And second on the agenda is the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay. Do we have anybody signed up for public comment? Okay. All right. Number 3, public comment. Is there anyone in the audience who wants to make public comment? No one? We don't have anyone signed up either, so. Okay. Number 4, approval of the minutes from February 11th, 2025. I need a motion. Jeb, get a brain fart here. Okay, Jason, I need a second. Al, okay, thank you. Any discussion or changes? Okay, all in favor? Aye. Opposed? Minutes are approved. Number 5, policy issues, discussion and potential committee determination, none. Number 6, operational functions required by statute, ordinance, resolution, or policy. A, discussion and possible action by public safety, none. B, discussion and possible action by public safety to forward to county board for consideration. B1, consideration of a letter of support for attic services for housing help program funding applications. And Lance, you want to take that one off?
Absolutely. Thank you, Madam Chair. If you look in your packet, there is on page 15 begins a letter from a representative from Attic Correctional Services, who you'll hear a little bit more about later, that we've worked with for a number of years. And this is a program that the county doesn't certainly fund through our annual budget, but it's a program that they have offered in the past. It relates to their ability to find and offer housing resources for people in our community. And my understanding is that Attic Correctional Services is looking to make application to potential funders to reinstitute that program. I know, of course, the county board has identified expanding housing options, and particularly for our justice involved folks, that barriers to housing and unstable housing are certainly something that we do in a lot of our other programs, particularly our treatment courts. We do work to address because, again, those things are kind of foundational to people's success. I don't know if Sean is available virtually, if he's logged in, if he has anything to add, but the request from Attic Correctional Services was whether or not the county would essentially offer a letter of support that Attic could then use when engaging potential funding sources, particularly through the state and grants, to reinstitute this program and bring it back to north central Wisconsin. Is anybody on, David, or not? Yeah. Sean, are you on?
Yes, I'm here. Can you hear me?
Yes, we can hear you. I teed it up for you. I don't know if there's anything specifically you wanted to add or if I misspoke.
No, I appreciate that, Lance. Just to add a little bit more to that, we did have a small grant in 2022 that allowed us to help 12 of our clients obtain housing, and to date, those have maintained that housing. And so we saw a lot of success, and we want to continue to expand that through different sources that our Attic's grants person should be able to identify and help us apply for.
And one other piece of information, I believe Sean, you're going to present to the Homeless Task Force, the Joint City-County Homelessness Task Force at their upcoming meeting, similarly seeking a letter of support through that grant application process. Is that correct?
Correct. Yes. And this is just outlining just support that, the county and homelessness task force is on board with us seeking this additional funding and supports the overall, vision of that program.
what do we need? Do we need
So a motion, this is agendized for it to go to the county board, which has generally been the process for letters of support. If you would recommend that it go to the county board, the recommendation, at least in my mind, and Mike is here, so I always like to put the lawyer on the spot when it's not me, is to direct county administration to make a motion to forward to county board for consideration to direct county administration to draft a letter of support on behalf of the county board for this program.
okay, any discussion from the committee? Any questions? Then we need a motion to forward this to the county board in support of a letter for Attic. Deb, thank you. Need a second? Al, thank you. Anything else? Okay, all in favor? Aye, opposed? Okay. And number 2, consideration of drafting a letter of support to the state of Wisconsin for funding support for medical clearance program at North Central Healthcare.
So I can tee that one up as well. Kind of same backstory as to procedurally why it's in front of this committee and ultimately could go to the county board for consideration. But from a practical matter, there again are, I believe, letters in your packet from the sheriff as a draft, as well as from North Central Healthcare for a draft. Suffice to say, and Chief Deputy Milhausen is here, but suffice to say, medical clearance is a process that is a challenge for law enforcement, not just locally, but throughout North Central Wisconsin and really across the state. And what that process really succinctly put is if an individual is engaged by law enforcement because law enforcement gets a report that they believe the individual is a danger to themselves or others and suitable for mental commitment, or at least an emergency detention, the process is that before they can be taken to an inpatient facility, a mental health hospital, they need to go to a hospital like Aspirus for medical clearance. Well, that can result in law enforcement, whether it's Wausau Police Department, the sheriff's office, or any other municipality locally, their law enforcement officer having to take that individual, transport them to the hospital, the physical emergency department, and wait for that individual to be seen. And that can take some period of time based on the individual's condition. And during that time, of course, that individual isn't getting care for kind of the underlying need for that resulted in the call, which is their mental health. So the state of Wisconsin has been working on this, quite honestly, for a number of years. But my understanding is they are evaluating, and it was talked about in the governor's budget address, evaluating options to take that medical clearance process and change it to identify some regional facilities that would be able to do that in a more efficient manner. North Central Healthcare, again, a partnership between Lincoln, Langlade, and Marathon counties, is very well positioned to do that because we are one of the very few counties in the state of Wisconsin that has our own, essentially, inpatient psychiatric hospital. So the opportunity is essentially to try to locate medical clearance on site at North Central Healthcare, bring those resources that we need to have to deliver medical clearance on site, alleviate strain on the emergency departments, but also then get that person hopefully care for their underlying mental health condition in a more timely fashion, while at the same time alleviating some of the staffing concerns that law enforcement has. So if you have specific concerns or questions about what does this mean for impact on law enforcement, Chief Deputy Milhausen is here. Gary Olson is here from North Central Healthcare to answer additional questions. And again, like Sean just did, correct any misstatements I may offer. But Gary, you have anything else you want to add? Just grab a mic if you do.
Okay, sorry. I was just going to say you teed it up very well, covered all the basic points, so I can answer any questions. We do, as Lance said, we are well positioned for this. We have the space that would work well for this. We are putting together a dollar amount that then would go to our members of the legislature for funding for it. So what we're asking for is this letter of support so that we can ask for the funding.
And the sheriff, in his capacity as an elected official, has already drafted a letter kind of outlining, again, from the perspective of law enforcement, some of the positives that he would see.
Correct.
Okay. Any discussion or questions from the committee? I will need a motion then to support this letter to the state. Jason, need a second? Deb? Okay. All in favor? Aye, opposed? Here, we'll send another letter. Easy. Okay, number 7, educational presentations and committee discussion. 7A, introduction of new jail administrator Lucas Volden is Chief Deputy. Bill Milhausen is going to do that, I believe.
Yes, thanks, Madam Chair. So as most of you know, Sandra Ledoux, she moved on to greener pastures, if you will, and that vacancy was left behind. So Lucas Volden, the one, the only, in person, looking pretty sharp in his uniform. Not me. I apologize for my attire. But anyhow, Luke's been with us for a little over 9 years. Started here at the sheriff's office in the jail and worked his way up, kind of fast-tracked through multiple ranks, and was one of 2 candidates we had in-house, and received the promotion back late '24. Yep. Yeah. So he's doing a great job adjusting, but we wanted to get him before the committee. So if you guys could put a name and a face together, and if you have any particular questions, you can hunt him down or ask him now.
Thank you. Congratulations and welcome.
Thank you.
Okay, we'll move on to 7B. Review of key performance indicators, information from Justice Systems Program.
So I'll start, and then I'm going to kick it over to Laura Yari, our Justice Systems Coordinator, and Michael Schultz, our Data Officer, to get into the meat of the presentation. And just to orient you, there are kind of the data reports. Those are in your packet beginning on page 4, but we do have a bit of a slideshow for you that, or PowerPoint, I should say, but it's largely recycled. So if you don't, if it all looks familiar to you, for those of you that have been on the committee, it should. This was the same framework when we provided our treatment court presentations to you a couple of months ago, talking about the data strategy and the work that we've done to provide those key performance indicators. So I'm going to start with kind of the background of an overview of the overall goal of our process. And then, like I said, Michael and Laura are going to take it from there. So the idea, again, of focusing on data, it's everywhere in life, right? We see it, you know, if you watch football or pick your sport, right? The idea of analytics, and you see the little thing that says powered by Amazon Web Services, AWS, likelihood of catch, 12%. Government is no different. So Marathon County, a number of years ago after I started as administrator, this was really an area where I wanted us to get more involved, and certainly the board did. The vision for the project is really Montgomery County, Maryland. And my challenge as the administrator here in Marathon County is we need to right-size our program and our approach. And just for context, Montgomery County is essentially Washington, D.C. suburbs. Their data team is more than 40. They've been doing it for more than 15 years. And their budget, I think, for their county is like $4 billion or $7 billion. It's big. So our data officer is our only data employee here in Marathon County, 1 to 40. But as you'll see from the presentation, I think we're doing a really good job getting this rolling. The one piece of context, additional piece of context you'll see as we get into the work here with this data before you is all with respect to our partner that I referenced before, our vendor, our contractor that we've utilized, and that's Attic Correctional Services, as opposed to some of the programs that you've seen before, whether it's in the DA's office or our treatment court programs, that data set, those data sets live elsewhere. The DA's office has their own system. Our system for our treatment courts is CORE, a purpose-built system for tracking. What you're going to hear about today is a lot of work that I can't adequately describe that went into really trying to extract data through working with Attic Correctional Services through a lot of these justice system programs that we've delivered for a number of years. So through the presentation, we'll take each data report page individually as we move forward and talk about what it is at a very high level, and Laura can walk you through that. And Michael's going to talk through a little bit of the process that she went through to get that, be able to get that data. And I'm really proud of the work that Michael's done, and Laura can talk about it a little as well. This was a monumental undertaking, to say the least. I didn't adequately understand the amount of behind the scenes work that needed to go in to what it takes to be able to pull meaningful information out of the system and have it reported in a way that is, I think, meaningful and helps us ask better questions, which is the goal of all of our data work. So Michael will give you a little bit about kind of what that looked like. Again, the purpose, and when you get to the slides, and I think it's important, again, for context, these are meant to be important for you, certainly as county board members, but I think it's also a really good public engagement tool, a tool to communicate to the public. It has been my experience that very often the public wonders, what is it that county government does? In new employee orientation, I talk about county government being the least understood level of government. People understand they think they understand what their local municipality, their city does. Everyone hears a lot about the federal government. We think we know what that does in the state. County government sometimes is different. In our programs and services, we deliver a lot. We did an inventory a number of years ago as part of a project. And depending on how you count what is a program, but across the county, we had over 1,000 programs based on that inventory. So we're trying to identify, and we started our data project with the court system because it's a very visible, tangible thing that county government does in partnership largely with the state, because a lot of our justice system, in fact, the courthouse we're in is really the state courts. Marathon County Circuit Court is a state court system. At the DA's office, Kyle's in the back, District Attorney Mayo, state employee, all of his ADAs are state employees, the judges are state employees. So it really is a partnership, and the justice system was, from my perspective and in speaking with the county board, kind of that first place to start. If I could go back, this one was a heavy lift, so I might have started with some easier ones if I could go back. But we have made a lot of progress, so happy to kick it off. And I guess with that, I'll leave you with one analogy as Michael starts to talk through the process that she went with to overcome some of these data limitations. And I'll show you before we get too far, but the vision, if you go to Montgomery County's website, their data, I'm showing it right now, and there's a link in the presentation that we gave back in October. But their dashboard, this is again the vision of what we want to work toward, and I think we've laid a lot of good groundwork here. But you can click on, and I'll just, for illustration purposes, they don't have a court page. So when I said we're doing good, we're doing real good. We're going to have something they don't have after 15 to 20 years. Their Department of Health and Human Services, you'll see the same framework for each program. They'll have the program, and then it's this framework of how much do we do, how well do we do it, and is anyone better off? To try to communicate to the public, and I think to the board, important aspects of those programs. So that's the kind of key into the presentation. But when Michael's going to talk about overcoming our data limitations, I want to give you an analogy, or actually my lived experience when I came to the district attorney's office. And this was a similar situation that Michael and Laura ran into when we were talking with Attic Correctional Services and the way that they captured information. I came from, I was an intern during law school in the Milwaukee County DA's office. There are well over 100 prosecutors in Milwaukee at the time, and now there's still way more than 100. And they had a whole army of interns, of which I was merely one. But they had systems for how they captured information. So back when I would go to court in Milwaukee, we still used paper, still had files when I was there. So that was 19 years ago. The file itself had columns and rows and specific places where every person needed to put the information, the specific information from every court hearing. The court hearing that they attended, they had to initial who they were, and then they had to write who all appeared, and there were columns for various parts. If a defendant didn't appear, you checked a certain box. And then I pulled it out when Laura and Michael and I were meeting in my office. It was either this week or last week, but we had an entire book of standard policies and procedures and a whole couple of pages of abbreviations that you had to use for the various crimes, because there are a lot of crimes in the state of Wisconsin, so you'd want to write down what was happening. So ESPIDU, a little abbreviation, and then endangering safety by use of a dangerous weapon, OMWOC, operating motor vehicle without owner's consent, and the list went on. There were a lot. When I came here to Marathon County, it was about a tenth of the size in terms of prosecutors and general population. Milwaukee had been doing it that way that I described for years. When I came here, that wasn't the case. Every prosecutor kind of did things differently. We had files, no lines. They were like your normal 8.5 by 11 or a larger file, but some people took notes this way across the top. Some people took notes this way, and I actually found files where they wrote at an angle. And some people took a lot of notes, some people didn't. People are pointing to Mike that he took them at an angle. But it was just a lack of standardization. And look at what our DA's office, how they've changed now. They're first off, they're entirely digital. Everything is through their laptops in a shared system. There are those standardization processes, so no matter who's covering a hearing, you pick it up and you know what happened historically, and you can get a lot of information very quickly. So that when Michael came in to work with ADDIC, we had a system that we purchased between 10 and 15 years ago, 14, 15, and everyone used it, but they all used it differently. So when Michael came in and tried to, all right, what information can I pull? We found out that there were, and they'll correct me, but like 600 event codes that we were using. It was more than that, Laura's telling me. And people used them differently. And there was just there wasn't that standardization of process. So Michael has done a ton to go back and kind of build from scratch the system for us to pull information out of. And now you guys can come on up and scroll through the slides, but Laura and Michael will talk through the work they did, and then we can start to talk through the data that you have before you. And my last piece of information before I step off to the side is same thing I said back in October. This is a human system. The data we believe is accurate. It is not precise. We talked about CCAP, the Wisconsin Circuit Court Access Program, where all the courts put information. As I shared in October, we know there are errors in CCAP, that things are put in inaccurately or it's a human system. This is far better, infinitely better than we've ever had before. It's not perfect, but I do think, and Laura will key up a couple of areas where even already when we met, the information we got is triggering us to say from a staff perspective, hey, it's causing us to ask some additional questions. So with all of those caveats, I'll turn it over to Laura and Michael, and you guys can come up and use the mic.
I'll be on deck. Hi. Yeah, I just wanted to add on to a couple of things that Lance touched on. This system was originally intended for a probation and parole department, and it was purchased as a case management system because the case managers are tracking large amounts of people and trying to get away from a pad and paper and Excel spreadsheets. It was purchased for case management with the hope of being able to use it for data retrieval. And so when we purchased the software, we were told that you could create as many boxes as you wanted, and you could enter data as long as it was in a Dropbox, it could be retrieved. Well, not by me. I just have to shout out to Michael. She is amazing. She was able to dig into this system. We went from having over 600 codes that were being entered down to 250. We have assigned to each program exactly what their codes are that they use. Michael was able to go into the backside and actually create the reports that weren't in the system. The system came with some canned reports, but they weren't reports that were useful for key performance indicators. It was more demographic, a type of pull that could be made from the system. So there was a lot of information in the system, and for a long time, I mean, if I wanted to look up an individual and find out what programs they went, I could look at the event codes and see how they moved through the program, but to be able to pull that data out in a meaningful way, we were never able to do that. Some of the things that we've been able to do, it took a team of individuals. It took Michael's knowledge of the backside of the computer and the programming and the coding that's required to create these reports. It took the people that were doing the work and entering it, explaining to us what they were entering and where. And then I was the one who was saying, these are the KPIs that we need to know. These are the data points that we need to use in order to figure those numbers. And then Michael's ability to build in the math so that this data is actually coming directly from the database, where presentations in the past were pulled and tallied and presented by staff and myself. So these are the exact numbers that are coming from the data that's been entered for the year 2024. So these are 1 year of statistics from last year. This has also allowed for, I can be at my desk and I can press a link to a certain program and it will pull up everybody in the program, the last contact that was made with them, where, whether a letter was sent or where they're at in case management. It shows us everything time-stamped, the staff member that entered it, the day it was entered. So it's been very helpful. It's given us a new level of transparency to the programs and what's being provided. I had a meeting with Ruth from the district attorney's office, and we were able to pull up everybody's caseload and see exactly what the numbers were for each individual and how many they were actively case managing on that day. And it's very transparent, and the more trust in the data that it's being pulled directly from what's entered. So, as Lance mentioned, it's not perfect. And we try and get it as perfect as we can, but there's always going to be some minor things. But overall, we spent a lot of time going over it and verifying that we were pulling things from the correct place and getting the correct numbers. So, Michael, did you want to come up?
Thanks. Hello. My name is Michael Schultz. I'm the data officer. Thank you for having me today. Thank you for the introduction. And I'm here to talk about data. So as we talked a little bit about the organizational shift that we're doing, again, this is beyond public safety. This is beyond any one department. We're doing this key performance indicator across Marathon County departments. And I've been tasked with starting with the Justice Department. And so I've been pleased to be able to work with a lot of subject matter experts and be able to ask, tell me more about how you enter this information. How can we display this to be able to make this data more accurate, more timely, and more available? So when we went in to look at one solution, sometimes when people ask, hey, can I see the data behind this program? A lot of times it's not a simple matter of going to find that data and press a publish button. Sometimes it's in an older legacy system that takes a very specific set of skills to be able to pull meaningful information out of it, and that was the case with one solution. So we did have some data limitation challenges like we do with any data project. But one thing that happens if we do have an issue where we pull information and we say, wow, this data quality is frankly pretty poor, this isn't something that we can turn around and report. There's missing information. There are things that are coded inconsistently. And so we have an opportunity for data standardization. And that's where we talked about streamlining those codes, making sure that we're working with the case managers so that they're all on the same page for how to document referrals, how to document when someone comes into their program, whether they're discharged successfully or unsuccessfully, and agreeing on what terms that we're using, since intake is not necessarily the same as admit. So a lot of time and effort was spent trying to standardize this in order to pull information that's going to be useful for our committees and the public. So each program operates just a little bit differently, and the technological skills of case managers does have to be taken into consideration. So we had some trainings. We worked with the case manager that was very familiar with the user end of the program, and she was able to be a translator between my set of skills, experience with working in these programs, and then the actual work that the case managers do in order to make sure that we're collecting everything properly. Change management is difficult. It does take a while, but I do want to thank Attic and the case managers for working with me when I knocked on their door and said, hi, I'm the data officer. I'd like X-ray vision into everything you do on a daily basis. Please and thank you. We're trying to normalize that process where we're able to come in and share that information and be able to create these reports that you're going to see here in just a moment. So now that we're able to pull information through lots and lots of coding, that black box that you see there is just pages and pages of me manually programming what we need to pull out of these systems because it's not something that's built in. We wanted to make sure that anything that we did do was sustainable. It's not just a matter of pulling the information and then manually building them every single time someone has a question. It's, well, let's see if we can make this last. And so what we've done, we've created some real-time reports for case managers. And in the top right, you'll see where, again, the personal information's been blacked out. But this is an example of a report that each case manager gets that's specific to them and their programs. It's automatically pushed to them every Monday. So when they get there in the morning, they have essentially a little Post-it. You'll see some red boxes there where if a client has not had activity on their account or on their case for over 30 days, it automatically turns red. So it's kind of a little bookmark of, hey, this person might need a follow-up. Now, it's up to the case manager to be able to look into that, but it's also something that Laura's able to look up on her own as well. So we have more transparency into how things are done. And when I say real time, let's say that a case manager meets with a client and they log that in the system and they hit save. Laura from her desk here at the courthouse hits refresh on that report and it's there. That's the kind of lack of delay that we have now with data and information in order to be able to get answers to questions quicker. Sort of like how many people are in this program. Well, the old way of doing things is, well, let's ask so-and-so who's going to check their notes and their Word documents and their spreadsheets and their paper files, and then they're going to report back a number to us. But by the time we share that with you, it might have changed. But in this instance, this is something where it's a useful tool, not only for the case managers organizationally, but also for our team to be able to have that transparency into what's being done in those particular programs. Lastly, we created some references and cheat sheets. So we're giving these case managers tools not only after all of our cleanup that we've done in the system, we want to keep it clean. We want to make sure that these standardization processes and improvements that we made are, again, sustainable. They're going to last. It's not like we're going to go right back to having a program that has 600 different event codes. We have our cheat sheets. They know this is the list that I need to work from in order for us to build these reports properly. So these are the, you'll see these in your packet, the 2024 Justice Program reports as they are in One Solution, the program that ADDIC works with. This is going to be based on the results-based accountability, which is the how much did we do, how well did we do it, is anyone better off, and these key performance indicators, or KPIs, they're typically going to raise more questions than answer, and that's a good thing. Data is a back and forth. It's asking questions. What does this mean? Why is it showing up like this? Now, everything was built in Power BI, which connects directly to the program that ADDIC is using. So the case managers, when they update something, it's going to pull straight from there. There's no spreadsheets or emails in between. It really should be like, for example, you'll see how much did we do total admits. It says 81. All the math is built into Power BI. I can't click on that and try to type it in. It automatically populates with that information behind the scenes. Now, this is not my area of expertise. I can build these reports, but I'm going to hand this back over to Laura Yari, who knows these programs inside and out and can share with you a little bit more about what we're seeing for each report. And then at the very end, I'll kind of wrap it up with next steps. Oh, sure. Yeah, I can do that.
Okay, which slide do you want? All right, on this first slide, this is the diversion program stats. Now, Ruth from the DA's office and her staff also monitor some of these cases. So this slide is one of the full-time case managers over among the ADDIC staff. And this particular individual has been with the agency for at least 25 years. So he's a very seasoned case manager. The diversion program is, again, the deferred prosecutions and the deferred entry of judgment individuals being diverted away from the traditional criminal justice process. So this one is pretty straightforward. There were 81 people who were admitted by this case manager. Over the year in 2024, he served 133. That's because a lot of these agreements go on for 9 months to a year. So there were carryover individuals included in that 133. We broke out how many of them were deferred prosecution agreements and how many were deferred entry of judgment. The success rate for individuals that completed in 2024. We have some goals that we put on here based on goals that were listed in our request for proposal from the agency. And also some target goals on things that we would like to improve. You can see that below that and how well we did it, the extensions in the program. That means individuals that required extra time. So when they originally agreed to do their diversion agreement, they said they would do it in 9 months. Something happened where they were unable to do it within that time frame and they were granted an extension. We like to keep that number low because we want people to finish timely according to their agreement, but there are sometimes things that come up that prevent them from being able to do that. Employment, you can see in this particular program, it's pretty consistent from intake to discharge. That's actually a good thing. Going through the criminal justice system can have effects on people's employment. We want people to maintain employment. That's part of the logic behind diverting so that people don't have a formal criminal record. That formal criminal record can lead to difficulties with employment, with housing, can lead to young people losing financial aid to further their education and other things.
So the unemployment I'm looking through, the unemployment rate is actually fairly high. Like, are these people living with somebody?
There could be, I mean, I don't,
For the different,
yeah.
you know, just in case, so, not just looking at a case of citizen, if they're not working or,
We also have a lot of students.
oh,
Yeah, there's a lot of young people, a lot of students, a variety of reasons why, but yeah. All right. So this next slide is basically the same population, the same program. And we've talked about combining these in the past. These were two separate programs where one focused on first-time offenders, very low risk. Now the case managers are basically sharing the same caseload. It was entered differently in our system, so we've kept it separately. We can put it together, but I thought it was worth breaking it out by case manager because one thing that I can say about this is this particular position had a lot of turnover in 2024. There were 3 different individuals working on this caseload. And as you can see from the statistics, I don't have any proof that that's why the success rate is lower for these individuals, but I think it lends something to look into more about training and getting individuals up to speed. I mean, turnover right now it's been very difficult to get staff and maintain staff, good staff. So that's something that we need to look at more cross-training and making sure that when caseloads do get turned over, the services don't suffer from that. So again, these individuals, I should say, had 53 admits. They served 82 people. This caseload was full-time, but because of the turnover, the other case manager was taking on more of the caseload and assisting with keeping things going. You can see the deferred prosecution and the deferred entry of judgment breakdown. The success rate is at 60, which is significantly lower than the other caseload. The extensions were a little bit higher. Again, it's that case manager's job to stay on people and be meeting with them and calling them saying, you know, did you get that done? Did you schedule that appointment? You know, keeping them on track. Again, the employment is relatively stable. This would also be the similar population. I would guess that there are students in there, some that are, you know, the 17-year-olds that are still in high school are included in these programs as well, so.
Can I offer one thing? Yeah. Well, I'll pose the question and then Laura can answer it. So she already brought up the importance of, you know, because again, the difference between the first slide and the second from a programmatic standpoint, again, just to re-emphasize what Laura said, they're very, very similar. So what it causes us when we met, was that last week? Last week? That was my question. Why is the success rate that we have in this instance different? It's helping us ask more questions to have that conversation. And I think Laura's professional opinion is something we need to look at. Is it a turnover? And then I don't think we're going to get away from turnover in today's economy and just the general approach to workforce retention. That's a challenge for everyone. So it's how do we make sure we have formal training, very standardized training processes in place. And then the other part is making sure that our data collection processes are standard. Do you want to hit on perhaps or talk about how that Michael's report that now gets pushed out every Monday would be valuable in perhaps addressing some of that? Because when did that start? September is when that red box, she also has a yellow box report. So red box is a thing to follow up on, as is yellow. How, if at all, is that helpful in addressing some of that turnover and training part?
Sure. So that report gets transitioned to a new person who's taking over that caseload. They immediately know everybody on their caseload and where they're at in the process. If a red box is coming up, it's a sticky note saying, I need to call that individual. They need to be working on, and you can see right on the report, the last thing the last case manager did with that individual. So it's just, it helps with the continuum of care. The caseload can easily be moved to someone else who can pick up right where the last person left off, and not have to go search through files and say, okay, where was this individual at? What are they supposed to be working on? It's all right in that link.
And that should help us with success rate.
Absolutely. Yes, that would definitely help keep on track. Ready? All right, this is another diversion program that is specific to domestic violence, misdemeanor, low-level offenses. This program was actually created because we had individuals that were being court-ordered to do the SAFE program as intervention as part of their agreement in their diversion. And in the past, there was nobody monitoring those. So if they didn't go on formal probation and the judge ordered them to do it, there was nobody following up to make sure they did it. So this program has been around for a very long time, probably 18 years. This individual is actually part-time. Job shares with another position to make it a full-time position because we've obviously, if we can offer full-time, we have a better chance of retaining people long-term. So this individual meets with people who are offered the deferred. They usually get 9 months to complete. They make sure they get over to the SAFE program timely, get their intake completed. They handle any concerns with that individual not complying. They keep in contact with the district attorney's office and the courts regarding the person's progress, and then report back when they have completed the agreement. So there were 71 individuals that were admitted, 92 served. You can see the majority of them are a deferred entry of judgment. So the person is basically admitting what they've done, agreeing to do the treatment in exchange for a reduction to a city ordinance typically. Success rate it's not perfect, but it's in a reasonable range. There's many reasons why people wouldn't be successful. If they didn't complete the treatment they agreed to would be one reason. You can see in the bottom right corner, there were 2 people that had some sort of new criminal activity that made the agreement off the table. That's also part of the diversion process, is that they stay out of trouble, future criminal activities. You could see with this program, there was a little bit more, 14.8% extensions required. The SAFE program is a closed group, so they start at a certain time and end at a certain time. And so depending on when you call to do your intake and your appointment, it can take longer to get into the program. And it is a very long program, so there are situations where individuals don't get in as quickly as they need to complete on time, and that's when an extension would be granted. And again, the employment is very consistent. So these individuals who were working maintained that employment. These groups are pretty intensive. It's a long requirement. So we want to make sure that they are able to maintain staying out of criminal activity, learning some skills to avoid future domestic violence offenses, and going on with their life. OAR diversion, this one is individuals who are operating after a revocation of their driver's license. So in the state of Wisconsin, when you are convicted of a OWI, you lose your license, and you can't get your license back until you do a traffic safety assessment and then follow through with whatever the recommendation is, whether it's an educational group at the tech or formal treatment. You get a year to complete your plan, and if you don't do it, you lose your license until you comply. So the OAR program is individuals who, for one reason or another, did not comply with what they needed to do to get their license back, and they continue to drive, and it is a criminal charge. And so this program works with individuals to make a direct contact to the Department of Transportation. That's who decides when they get their license back, and helps them work towards doing what they need to do, whether it be completing their treatment plan, having an interlock installed, making sure they have proper insurance, completing everything that they need to do to drive legally and safely. Obviously, in Marathon County, it's pretty difficult if you don't have a driver's license to do the things you need to do in life. Getting to work, taking your kids to school, doing your grocery shopping, all the things that people need to do. And we also want to make sure that people who do have a substance abuse problem, it's identified and they receive services so that they don't have a repeat offense. So in this program, the numbers in this program actually go down as the program that's going to be talked about next goes up. So this one, there were 28 admitted, 46 were served, 10 were successful, 5 were unsuccessful. You can see that 3 of those 5 had in-program recidivism, where the district attorney's office made the decision to take the agreement back. They could also be unsuccessful in this program if they simply don't follow through with completing everything they need to do. The DA's office does a really nice job of trying to screen out those individuals who don't have a chance of getting their license back. Some people have incredible amounts of fines and things standing in their way that it wouldn't be reasonable to accomplish in a diversion agreement. So there's a lot of screening that goes on before they are referred over. Let's see, and then licenses reinstated. You can see out of the 15, 9 were able to get their license reinstated. A lot of these individuals are people who have repeatedly gotten OARs, and so stopping that cycle. 5 were unsuccessful for whatever reason, and 1 was ineligible. And ineligible means DOT. There's something about that, whether it be a large amount of money, they're not eligible for a driver's license, they had a significant revocation period ordered. The rules around getting your license back have been more difficult and longer amounts of time with the OWI convictions. So SSTOP was the program I was talking about. This is the program that's designed to help people comply in the first place so that they get their license back and they don't operate after revocation. So SSTOP has been around a very long time. It was originally a grant program that was started through the state. Back in 2004, we had over 50% of the people who were convicted of an OWI and ordered to get an assessment never complied. They either never scheduled an appointment or they got the assessment and never did the classes or the treatment to get their license back. And so this program, the case manager goes to court on Mondays to traffic court, and anybody with a second or third OWI is given the opportunity to do this SSTOP program. The case manager works with them, helps explain the process to them. There's a lot of things that you have to do to comply. You have to get your traffic safety assessment within so many days. She helps them if they're eligible for an occupational license, getting special insurances that they need, getting interlock devices. If you're a second or third, you're ordered to do that to drive legally. She then has the individuals begin the process of complying. So they get their assessment, they identify their treatment provider that they're going to go to, and they start attending sessions. Now, where this gets a little bit confusing is there's 2 different ways to go through this program. Some of the branches will hold the case open for the person to complete everything, and then they're allowed by sentencing to give them a reduced jail sentence in exchange for complying with everything. And so when they sentence them, they get the reduction on their sentencing jail days. The other way they do it is the person pleads guilty after they've done their assessment and their 2 sessions, and then the individual is given imposed and stayed jail days. So they'll serve the mandatory minimum that's required, and then the case manager over at ADDIC will follow up with them for the year and make sure that they complete everything. And then if they complete everything, those jail days go away. They're never imposed. If they don't complete everything, then those additional jail days are imposed. So it's a process of, number one, getting it started quickly. They're starting right after their initial appearance instead of waiting for their case to completely move through court and be completed. So they're starting the process right away. And from the information here, you can see that a lot of them are able to drive legally by the time they finish this program, so that in the end, then they're complying and not getting continued charges for operating after revocation. So if you look at how well did we do it under the success rate, you have to add the 2 colors of green together. It's a little deceiving. We didn't know how to make it look the best in a pie chart, but there's the lighter green are those that finished with holding it open pretrial, and the dark green are those that finished after sentencing. They, worked with the case manager in the year following, and then had their days disposed of. In program recidivism, 90%. Yeah. So yes, the individuals who participate in this program have a very good rate of completing what they need to do. Yeah. Yeah, it's a lot better than 50, as Lance said. We'd much rather have that extra 40% of people not getting arrested next year for an OAR or next month for an OAR. And the in-program recidivism rate for this one, we pulled out specifically individuals who had new OWI charges, which we want to avoid at all costs. But as you can see, 6.76%. So these are individuals who already had at least 2 and likely need quick intervention. Even with intervention, taking a year to close a case to start the assessment and treatment process is not the best. The quicker they get into treatment, the more effective it is. So then there were 44 people discharged. 32 of the 44 were able to have a drive legally right out of the gates, basically. And then the jail days saved. The only way we figure those is specifically if the judge says at sentencing, I was going to give you would have got 90 because you participated, you got 30, then we count the 60. So when we did this program differently in the past, we had a lot more jail bed day savings. Now that they are doing it differently pretrial, the judge doesn't always say exactly what they're saving or what they would have gotten. So the case manager does a good job of following up on CCAP and documenting that, but it's probably significantly more than that. But I want to say I can't say for sure what a judge would have given someone if they don't say it. All right. Case management and treatment services. So this is a treatment program for very high-risk, high-need individuals. These are typically individuals who have not had luck at other outpatient settings. They have missed so many appointments that they owe money for missed appointments, or they have a hard time getting back into services. These are also our treatment courts refer to this program. So this is a program that we share with the Department of Corrections. They pay for a portion and Marathon County pays for a portion. It is intensive outpatient, so individuals get a lot of service hours. They come to group multiple times a week. They get individual sessions, case management. They have cognitive intervention groups that they run. You can see that there were 132 people admitted. Referrals for this group come from the Department of Corrections and our treatment courts. We occasionally will have individuals that are very high risk, high need, coming through county programs that can be referred for specific parts of this. The majority of the individuals are also they're on probation, have risen to that level. Some of them are on parole after coming out of prison, living in the supportive housing. There were 188 people served. Dosage hours broke out down below is the amount of face-to-face treatment intervention provided, which is huge. How well did we do it? The success rate, that's not where we would hope to have the success rate. In looking at this, I know that our treatment court success rate is higher than that. So we had discussions about a lot of these individuals are couch surfing. They don't have stable environments. They've failed in treatment other places. They're typically addicted to heroin, meth. They have the way this is figured is not ideal for a treatment program. A treatment program on a pass-fail, success rate is measured by them attending all of the groups. So it's attendance. So obviously, attendance for these individuals is an issue. We talked about breaking out the populations so we can put more focus, and addicts application for housing assistance would be a big help for that. These individuals, it's hard to focus on treatment and recovery when you're worried about where you're sleeping and what you're eating and where, you're forced to rely on friends that are also using. So we have a 60% goal there. I put that goal in as that's our goal for our treatment court. We want to have that success rate continue. We're also looking at other ways to manage or measure the success of a treatment program. So is anyone better off? We looked at employment, and you can see that there was an improvement in people getting jobs. Some of the unsuccessful people end up back in an institution or in jail, so it's hard to have a job if you're not out. But we're looking at other measures to more effectively gauge the success of the dosage hours that people are receiving. Sure.
So as Laura said, and we said at the beginning of this, right, sometimes the data helps you ask better questions. So again, really important to remember, this is a shared commitment from the Department of Corrections and Marathon County. This will be accurate but not precise. I think about, what's the breakdown of funding? Three quarters is DOC or 2/3?
It's probably closer to, they pay more than half, but
Yeah,
I'd pick
they pay more.
60-40.
Department of Corrections pays more for their program. So they have people coming in. Like Laura said, the majority of the people that Marathon County, specifically the county government, refers in are our treatment courts. And our treatment courts, as you learned in October, are doing, relative to treatment courts, really well. I think the state looks at us as a strong deliverer of those programs. What the question I had that I posed to Laura is, can we, and this is something we'll look at, dive into this data and essentially separate out the Department of Corrections referrals and our treatment court referrals to try to then better understand, are there certain things about our referral process and the supports we provide for treatment court, like Laura said, housing, and that really, we try to get them in early, right? There's a lot of upfront work we do with treatment courts. Are there differences between that approach and the Department of Corrections approach that then we can sit down with the Department of Corrections and say, hey, is this really the outcome you want? You're paying money to participate in this program, are there changes you can make to your referral process? Whether it's, hey, are you actually waiting too long? Letting things get to a point when the individual, their needs are, they're already on the course for failure, and there's not enough time for this to work, or it's not intensive enough to kind of divert them, and then they're going to end up back in the institution. Or are there programmatic pieces for CMTS that we can change to help be more effective on the DOC side? Right now, this is the data we have. It's helping us ask more questions. I don't know. My sense is, though, that's an area for us to look into. So I have no doubt you guys are similar in that you look at something and, I wonder what that means. It makes me think about this. That's why this whole project is so important, like we started. This is really helping us get better information. But on that CMTS slide, like Laura said, yeah, the success, it's not where we want it to be. That said, we do have other data relative to our treatment courts that shows the model that we're using there is really working, and CMTS is a big part of that, which begs the question, where isn't it working well? Because at the end of the day, everything for county board and the job I do as your administrator is to try to say, hey, what are your policy choices for you to really look at? And quite honestly, maybe DOC with this information makes different decisions as well. We are one of, and Laura can correct me on this, but we are one of the few counties that has that partnership where DOC utilizes those services and pays for those things, as opposed to the normal approach, which is just through probation. So again, good information. And if you think back to those previous slides about employment, like Laura said, it's not surprising at admission that the employment numbers are so low, or that they're low at the at discharge, for the two reasons she said. These are high risk, high need. So as opposed to the people on the front end who are employed, if you think back to the volunteer and probation program, or the diversion program, or even the domestic violence diversion program, those are lower risk offenders. They can hold they're generally speaking holding things together. They're low risk. It's perhaps their first offense, or early on in their criminal justice involvement. This is the opposite end of that pool. This is the deep end. These individuals have had a lot of interventions, like Laura said, burned a lot of those bridges. Our treatment court people, generally when they're going through the process, I mean, you're incarcerated. Your options are not looking good. You're perhaps discharging from an institution, from prison. We have people that get into our treatment courts as an alternative to revocation. So a lot more people start unemployed. I look at that as, hey, that's an improvement. We have more people that are employed. But again, the flip side of a discharge, that's not just successful discharges. That's any discharge. So if they are not successful, they're most likely in custody. Probation is putting them on a hold, or they're being discharged from one of our programs and going to prison or going to jail. So that's why the little blurb at the top about explaining what each of these programs are and the target population is important, because the measures you're going to have for each of them are very, very different.
All right. All right, the pretrial program. So the pretrial program is gets grant funding from the Wisconsin Department of Justice. Marathon County was selected as one of 7 counties to participate in this pilot. It came out of our evidence-based decision-making work, the pretrial decision-making point, the decision where bond is determined. At initial appearance was identified as a place in our system where we're making decisions about people's being detained or not detained, and there was no tool or mechanism in place to help with that process. So part of our pilot was to implement the public safety assessment from the Arnold Foundation. It was a researched pretrial actuarial tool to determine the likelihood that someone commits a new offense while they're out in the community awaiting their criminal process, or the likelihood of them missing court while they're out in the community waiting for their next court date. So we have a person who is doing this PSA assessment on every individual that is in custody for their initial appearance up in the jail. And that assessment is completed every morning, circulated to the system, the judge, the DA's office, the defense attorney. And that tool is supposed to not help judges, not tell anybody how to or who should get out or who shouldn't, but to give standardized information on who it is in front of the judge that judge is making a decision on. Now, the district attorney's office argues from their point of view, the defense argues from their point of view. This is an extra piece of information for the judge. It measures a lot of different things about that individual, tells them their previous experience with showing up for court, their previous conviction history. It identifies things that research has shown predict those two things that they're looking to predict, which is how they are determining whether somebody stays in jail pretrial or is released. There is always a goal to keep the right people in jail and everybody else not to be kept in jail. These people are pretrial, they haven't been convicted of anything. If people are held pretrial, they can lose their jobs, they get separated from their families, all things that have been shown to actually cause more risk to the individual when they get back out. Their stability and their supports in life are reduced. So there were 1,504 assessments completed last year. You can see how they broke out. So the reason those don't add up is we also have a level 1, but level 1 does not qualify for pretrial services. So people who score out as a level 1 are the lowest risk, and those individuals just receive text reminders from the clerk of court's office before their upcoming court dates as a reminder to help them keep track of their court dates. So those individuals that are level 2, 3, or 4 are ordered to pretrial services based on if the judge determines a bond amount or a signature bond and the person is released in the community, they're required to report over for participation in that pretrial supervision. So when somebody is released from the jail monitors them calling to the agency, reporting to the agency that they're being released. So the agency knows that they're expecting them to come over. So level 2 supervision, they have a face-to-face requirement per month and a phone contact per month. Level 3s come in every other week. Level 4s are required to come in weekly. The individuals are given screens for mental health and drug and alcohol issues. Nobody pretrial can be forced to comply or to start services, but they're offered that opportunity, and the case managers connect them with resources in the community to help them with those issues. There's a small amount of drug testing that's done in another program that's coming up, and that's based on whether the person was under the influence at the time of their incident, whether it's a public safety risk, if they're scheduled out as high risk. So there are some people that are also getting drug testing as part of this program. So out of the 1,504, you can see below the total referred to each level. Marathon County traditionally has kept only the higher risk individuals in pretrial. They have a jail booking system where if you're a misdemeanor, and they follow that process by the state, so they're screening out a lot of people that they don't hold. Primarily it's felonies that are held or domestic violence incidents. Sometimes it's also a probation hold. So the person would have gotten out, however, they also have a hold that's keeping them in, so they go to initial appearance then. So you can see how they broke out as far as levels where they scored. And then the ones that were actually, how well did we do it? The ones that were actually released at each level is in the how well did we do it? The 303 at the bottom is the number of those individuals released that ended up being admitted into the program. So the program is keeping in communication with the courts. If somebody is on the voicemail that they were supposed to report, they have so many days to report, I should say hours, and then they, the case managers are looking for them and then sending warning letters and then sending letters to the court, letting them know that they're not complying. So that's how they are tracked there. The graph at the bottom is a good display of how many assessments are done each month. Some Monday mornings are very rough. There's a lot, and then it just depends on how many are on the list that day. I think yesterday there were quite a few. I mean, there's been as many as 20, 25 sometimes since we've started this, and then other days there's less. So it just kind of depends. It's after a holiday weekend. It's bad. So we figured, it was nice and warm last weekend, so that might be why it was a heavy load Monday. So number of active participants who reoffended while in the program, 73. It's a lot of drug use, drug possession, a lot of drug problems. We see trying to, somebody is released on bond and you can't use illegal substances, but they're addicted to heroin or they're addicted to meth. Very difficult. That's one of the benefits of trying to get people through the process and into treatment as quickly as possible, because the likelihood of somebody the judge telling them to stop and they just stop when they have an addiction, it doesn't work well without intervention. The other thing is the failure to appear by level. So when we look at these last two graphs on the right side, as far as reoffense, it looks like the PSA is being predictive for our population. We're seeing the majority of the people who have a new offense are the high-risk level 4s, which we should see. And then the others are, 12%, 13%. So the bottom one, failures to appear, we got it right for level 4. The other two are a little backwards, and that, DOJ has been promising us an evaluation on this program, and we're getting closer to them. They've now provided us a database, part of CORE, that we are entering data in hopes of figuring out, we want to make sure that this is predicting correctly. And I can't say for sure what's going on with that, why more 2s than 3s failed to appear. It could be we have this colored graph of where people fall on scores. It could be that it needs to be shifted. It could also be that this database we're using, if they change levels, meaning if they go back in and they come back out again and their level increases, this is showing their current level when we ran this data. So there's some sorting out on that. Yeah.
Are these individuals that are, is it an individual that might miss 3 court appearances, or are these separate individuals?
They're separate individuals. That's a very good question, because we follow the measuring what matters, which is the official how you should measure these statistics. And I had the same question when we started this. There's different ways to measure it. They measure it as if you have 12 court sessions and you miss 1, you're failed. Even if you've made 11 of the 12, you're considered a failure, but it is per person.
Lance, what is the charge per hour to have court when somebody doesn't show up? What does that cost in the county?
That's a very good question. I have an email that I sent to a supervisor that kind of estimates that. The reason it's a complex question is when you look at the breakdown for how court is funded. Now, it's all tax money. But as I alluded to before, this is the Marathon County Circuit Court. A lot of it is state employees. So Kyle and his team of prosecutors. So the judge is paid by the state through state funding, a mix of various revenues. The prosecutor is paid by the state, various mixed revenues. The defense attorney, based on how the individual is appointed, if it's a public defender or public defender appointment, is paid at the state level. If it's a private bar lawyer, that is, Lance goes and hires his own lawyer, Lance pays. The exception is if it's a county appointed lawyer. So there is a circumstance in which if someone fails to appear, the county is arguably out the benefit of what you could have accomplished with the time of that person being there. The other expenses relative to court are court reporter, the person that takes down the minutes of those. That is generally speaking a state-funded expense. Then there are the court staff, and those are generally county-funded. So the portion that's county-funded is relatively low of that overall. If I use a pie chart again, it's a smaller slice of the pie, but I can get you an estimate of kind of what the potential loss of productivity is. A lot of that though is state. It's state dollars. And then I just had this conversation with a judge in the hallway earlier today. Well, it's a sunk cost. But my response, of course, is yes, it's a sunk cost. We have to pay the judges and the prosecutors and all those people are being paid, but it's the lost productivity. We could have handled some other case to move a case through the justice system. But to Laura's point, this is really it's applying that actuarial tool. Laura pointed this out in our meeting, the same sort of tool that tells each of us what we're going to end up paying in car insurance, that they use, same sort of tool based on our past behavior, what's the predictive amount. They use a similar sort of approach with respect to failure to appear and likelihood to commit a new offense.
Thank you.
Yeah, going back to what you said, it's paid by the state. That's still our tax dollars. So you're not going to get away from it. My question is, do you ever offer the people in your program the option of applying for Verde Street Mission program or the Gospel TLC program?
Yes, our case managers over at Attic are very familiar with all the resources in the community. And because all these programs are operating out of the same building, pretrial is right there with the CMTS and the diversion, and they all share resources and make those things available. Attic also has like a community closet in their basement. They'll have individuals come over for their pretrial with no shirt on because they don't have a shirt. And it's like, let me get you a shirt and then you can come in. So they try and help with food resources and housing resources and working to get them things they need to help them be successful. It's all voluntary. They can tell us no. We can't force them to do it, but a lot of them are willing and want those resources.
Okay, thanks.
So how much emphasis do they put on trying to get these people employed in that? Because I see the employment rate's kind of flat on the, in and out. And I think that almost coincides with the reoffending. When you look at people, if they got a will, a purpose, to do something, and they have a job and a reason to be a contributing member to society, I feel like they would have less chance of reoffending. You know what I mean?
Yeah,
So I'm just curious
employment
how much-
is a big predictor And they do have screening tools that they use with these individuals to identify what areas to make suggestions and recommendations. So yes, they do, again, they can offer the resources, they can't require somebody to do it,
Okay.
at least in this program.
Okay.
Diversion, yes. The diversion, they work with them specifically on that, yes.
Yeah.
And it can be part of an agreement.
I was just going to say that. Kyle's in the back, but, you know, it's very person-centric, to your point. To get the benefit of the bargain, the prosecutor on a diversion agreement is going to craft, hey, these are the things I expect from you. And one of them very well could be obtain and or maintain employment.
Or schooling.
Or schooling. You know, we gave that presentation I referenced before, I think it was October, about our treatment courts. Employment is required to graduate. So to your point, where it's available to require it, which is on the kind of the post as part of a plea and sentencing and follow through, they have that conversation. The DA's office is very good about saying, hey, this is our expectation of you. The difference is on the pre-conviction side. When your case is pending, there are things you just can't order people to do. You can make a lot of stuff available, and we try to do that, make resources available. But pre-trial, you can't require someone to, unless the courts require, even as bond, I think that's probably problematic. They don't. I see Kyle.
No.
I don't ever remember any bond conditions saying be employed.
No.
But we do on a lot of those programs, just not as part of pre-trial. We don't say you have to be employed. The important thing for pre-trial is we're trying to mitigate two things. One, it's just like your dentist, when you set your dentist appointment, they want you to show up. So you get the same text message reminders that I get to show up, like, hey, your dentist appointment's tomorrow. We do the same thing with court. We want people to show up. To your point earlier, Supervisor Wilhelm, about the cost. We don't want to have people miss court for reasons we can prevent. And then we also want to make sure that we minimize, or I should say, we make a good decision the judges make a good determination relative to bond to mitigate the risks for someone committing a violent offense while they're out on bond.
So I guess one question that I have is that in order to enroll in this pretrial program, so I guess is this almost like a plea deal structure? So I guess what I'm asking is there a presumption of innocence or is there a presumption of guilt, or how is this being evaluated?
There's a presumption of innocence at pretrial. So what this is if you are in custody for your initial appearance, so you've been arrested and brought to jail, they use the jail system to determine who gets out in order to go to their initial appearance and who is held for initial appearance. And you get held for initial appearance on felonies. If you have a probation hold, if there's a domestic violence, those are an automatic hold. Everybody else is released for initial appearance. So these are the individuals that are held, and every one of them gets a PSA assessment, and it's strictly for added supervision services. That's why they can't be required to do, we can't say you have to go start treatment because there is a presumption of innocence. Did you want to add from the lawyer?
Well, and lawyer in recovery, DA Mayo's in the back. But if you just think about it like we've all seen it on television, right? Remember, this is something that happens at your initial appearance. So you've just been charged with a crime. You come in and the court is asking you just a couple of things. First, how do you plead? And everyone always pleads not guilty. It's the way the criminal justice system works at the first hearing. And then the judge says, hey, I'm going to order you, this is the part that you've seen on television, right? I'm going to order you released on $100 signature bond, $1,000 signature bond, $1,000 cash bond, $50,000, $1 million. Pick a number depending on the offense. That's that hearing. So this is that very early, this is the first formal hearing in front of the court for the vast majority of cases where the judge is making the threshold determination of really what are you going to stay in custody or are you going to get out? And if you're going to get out, what are going to be the conditions of your release? So it's the same hearing if you watch Law and Order. It's in about the middle. It's after the law enforcement investigation, they arrest the person, and then they show up to court. And this is that actuarial tool that staff perform based on the individual's criminal history, their age, and other things that it says, hey, what's
Appearance rate in the past.
appearance rate in the past? Have you missed court in the past? It gives the judge, the DA, and the defense attorney just another piece of information that they then use to advocate. If you're the prosecutor, as I was back in the day, I'd look at past missed appearances, the nature of the offense, their pattern of bond compliance in the past.
History of convictions.
Yeah, previous convictions. The defense attorney would look at things like, hey, they're from here. They have strong contacts in the community. They can be trusted upon release. This is just another piece of information that each side can make their arguments with, and then ultimately the judge can use to render that decision. And what we then provide after that is that follow-up, again, for those things outside of the text message reminders for level 1 individuals, which is handled by the clerk's office. This is that, hey, do you check in if you're high risk, that level 4, weekly, every other week for level 3, and then once a month for level 2, and it's by phone. So it's just a different level of intervention, but it's not a requirement that people, hey, you got to go start treatment. They certainly, we make them aware of those opportunities, but it's the court under the bond statute has it's limited in what it can do.
Okay.
Hope that helps.
Yeah, and so, I guess then my next question, so then deferred prosecution,
Turn your microphone.
is it going? Okay.
You don't need to hold it. Yeah.
Oh, okay. So then deferred prosecution follows after, as far as diversion programs?
Yeah, Kyle can kind of, the differentiation between a deferred entry of judgment and a deferred prosecution is your question. So Kyle, you want to take that?
Absolutely. And part of the problem is there's no consistency throughout the state. So if you listen to other counties or go to other counties and talk about their diversion programs, the terminology is going to be different. So we call a deferred entry of judgment. Portage County might use as a pre-filing, like our deferred prosecution agreement. So we have a deferred prosecution agreement where it's prior to the filing of any criminal charges. So law enforcement has contact with someone. Those are low-level first-time offenders. We see it a lot with possession of THC, where they've already been cited by law enforcement. They've already had that intervention with the citation. They now get caught with THC again. We'll say, okay, before filing criminal charges, before anything is put on CCAP, stay out of trouble for 9 months, do an AODA, complete all the assessments. We'll never actually file the charges. So there's nothing public on CCAP or anything like that if they complete that agreement. The other option is the deferred entry of judgment, where they're charged with a crime, they go through the criminal process, and then they enter a plea. So they plead either no contest or guilty. The judge doesn't actually impose that judgment. So they're not found guilty at that time. He defers that judgment on that conviction for a certain amount of time. And deferred entry of judgments can be used in, we use them a lot in domestic violence cases where they can get reduced down to a citation or dismissal at the end, or we'll use them in higher level cases. When I was the drug prosecutor, I used them a lot on delivery of THC cases where we have a young individual that it's their first time that they're being charged with a felony. We'll defer that felony, and then at the end, we'll amend it down to a misdemeanor or something like that so that they don't have that felony. So the DPA, deferred prosecution, is prior to charges, never getting charged, and the deferred entry of judgment is post-charge at the time of the plea. Does that answer everything? Okay.
Nice way to think about it is that's the difference, like Kyle referenced. Each of those scenarios is really it's a contract between me as the defendant and Kyle as my prosecutor. I agree to do certain things, stay out of trouble for 9 months, undergo the alcohol and other drug abuse assessment in your THC example, and follow through with recommended treatment. If I do those things, he agrees at the end of that 9-month period that either I never get charged in the deferred prosecution context, or if it's a deferred entry of judgment, I was charged with the felony delivery of THC, I do all the things in our contract we write out, show up to court, I plead guilty to the felony. If I do everything, I come back 9 months later, Kyle verifies for the court, Mr. Leonard did everything he was supposed to do. In light of that fact, Judge, I'm going to move to amend count 1 from delivery of THC to simple possession of THC. And we have a joint recommendation of Lance is going to pay a fine and Kyle's going to pay it for me. No, I'm just kidding. But you can see that just it's a contractual relationship for each of the DPA, deferred prosecution, and the deferred entry of judgment, DEOJ.
Jason, you got a question?
Now, a question I have is probation involved in this? Like, instead of somebody having their probation revoked, let's say they are either testing positive for drugs, not showing up to their appointments, can they refer them to these programs? I'm just.
It
without
depends.
Some.
So in some instances, certainly probation is a referral source into our programs, like Laura referenced before with CMTS, Case Management and Treatment Services. Probation refers into. Probation can refer people into day report, that is the drug testing portion. Yeah, which is up next. For some things, though, probation's not involved, right? For pretrial, if the person is not already, they haven't already been convicted of something else, and they're just charged with a crime, probation parole is not involved. So they wouldn't be referring into those programs. Similarly, with low-risk offenders on diversion, the DPA agreements that Kyle just referenced, or the deferred entry of judgments. Deferred entry of judgments, it depends. If Kyle makes an agreement where, hey, Lance, you had your felony THC example, right? And I have a bunch of other cases. Kyle might say, we're going to put you on misdemeanor probation, misdemeanor supervision, comply with that, and I'll amend this felony down or it'll dismiss the felony. So it's very fact specific and individual specific. That's one of the things that I think the county board for decades has invested a lot in terms of offering a lot of options for people instead of just pushing everyone through the traditional justice system. Again, the big takeaway for a lot of this stuff is kind of based on your question before, what's the impact if you don't have it? Stuff slows down, if people don't appear, you send all of those operating after revocation cases, push them through court. When there's not enough lawyers at the public defender's office, there's not enough private bar lawyers to take those cases, stuff just slows down, which then people they offend on bond. It can have implications in the jail. So the county board has kind of made I'll say an investment to do a lot of programs to alleviate pressures that might come elsewhere. Hope that's a long-winded answer to your question of it depends. Anything you wanted to add, Kyle, or?
Yeah, I was just going to say for the deferred entry of judgments, a lot of times we'll use probation as a component of it. So it'll be plead to 2 or 3 misdemeanors, do a year or 2 of probation, and then deferred entry will be for maybe 5 years. So we'll get them through that probation time where they have the support of the probation agent, they get the treatment through probation, and then you have to prove that you can stay out of trouble not on probation when you're not being supervised for that period of time before you get the benefit of that. But it really is case specific. We use a lot of our diversion staff that you guys have met, have been here quite a bit, have a lot of knowledge on what is needed and what is the best outcome, and they have their tools that they use. So we rely on them a lot to help us craft it for that individual. So it's not a cookie cutter of this is your crime, this is what you get. We really look at the full picture of what's needed, what's going to be best for that person to hopefully bring that recidivism down and not have them come back through the system again.
Thank you.
So is this like a one-time thing? Like they can only go through this program once, or can they come back through again? And or I'm just like, can they continue coming back?
Kyle, do you want to?
Sure, I could talk at least for
Well, yeah, the diversion program versus others. I mean, is that you want program-specific diversion? Can they do it repeatedly, or?
See, like if they reoffend again So do they would get like kicked out of the program? Would they be able to, like if they offend again, do they go through the program again or?
It matters which program. So pretrial, every time they're held on a new crime for an initial appearance, they'd get another PSA. So yes, that one they can come through. Case management and treatment services is a treatment program that they can come through, especially if they were unsuccessful. A lot of the diversion programs, that's up to the district attorney's office. How they allow that, sometimes they'll initially give somebody a deferred prosecution agreement that they're unsuccessful at, and then they'll change it to a deferred entry of judgment, kind of turning up the accountability on it. So depending on the program, yes, there are multiple chances, but they're all different.
Okay, thank you.
Yeah, for deferred prosecution agreements, that's pretty much the one that's a one and done, because one of the requirements is it's a first-time offender. So if you had a DPA and you failed that, then we're going to charge you with a crime at that point now, and then you're going to go through the normal process. So generally, the DPA is a one-time thing. Deferred entry of judgment is a little different because it also depends on the type of case. So you might have someone that is a domestic violence offender that we put through a diversion program on a misdemeanor disorderly conduct domestic violence case. They successfully complete that, and then maybe 5 years down the road, we have a felony case. And we don't think that they necessarily need a felony at that time. Maybe then we'll do a deferred, we talked about where the felony would get reduced down and they would have the misdemeanor convictions. So that one really depends on the type of case. Generally, the same type of case, you're not going to get that opportunity twice, but maybe in different types of cases, you might be able to.
And one thing to add, and I think both Kyle and Laura alluded to this, it is program specific because I would characterize some of these things as tools for the justice system as opposed to a program that a particular defendant is benefiting from, like Day Report that we're going to talk about. That is an accountability tool that it's another form of accountability for the justice system, another piece of information. Similarly, case management treatment services, that's a higher level of service that the justice system can utilize to address behavior that we're going to have to otherwise address in different ways, as opposed to programs that are more, if I'm the defendant, I might look at, hey, this is a real benefit to me, like SSTOP, the ability to go through that program that Laura talked about. She just told me, statute, one time a lifetime. You get that once in statute. Whereas, like Kyle said, diversion programs, DPAs, deferred prosecution agreements, and deferred entry judgments, that's case by case up to the district attorney's office. All those programs on the front end about deferred prosecution, deferred entry of judgment, and the specific terms, that is driven by the DA's office. Now, ultimately, the defendant has to agree, right, because it's that contract, but the DA's office is in the driver's seat. If I do something, whether or not I get charged and go through the criminal justice system, or I get a deferred prosecution or no charge at all, that is a district attorney's office decision. When I used to teach criminology at the UW, people would always ask, one of the first questions I'd ask people is like, hey, who do you think is the most powerful person in the criminal justice system? Everyone always thinks judge. The district attorney's office, the prosecutor makes the decision about who gets charged, what to argue about bond, what your offer is to resolve the case. And ultimately, they make a sentencing decision. They drive a lot of the train. So like Kyle said, do you get it twice? Entirely up to the prosecutor. Now, they have to do that. There are ethical rules that exist, and our prosecutors here do a very good job of making those decisions in an appropriate way. But at the end of the day, that's a DA's office decision if they get in. So I think our last program is Day Report, and we'll try to go fast because I know Krista's got a rip-roaring presentation on truancy as well.
All right, so Day Report is one of those supervision tools. It's a program that is utilized by various programs and referral sources. Day Report referrals come from people who are in case management and treatment services, people who are in drug recovery court, directly from probation and parole. There's some pretrial individuals that are being tested through this day report program, as well as some diversion agreements include drug testing. The program is open every day, holidays. They're open morning and night. It's random color code call-in. So if you're on day report, you have to call in. If your color is on there, you have to come in for testing in the hours that the windows are open. They do urine tests, they do breath tests, they do saliva tests, they do check-ins. They, at times we have them monitor job searches and things where individuals have to bring sheets in showing the different places that they've applied. So for this program, there were 208 people admitted in 2024. They served a total of 301. You can see the bottom shows you how many face-to-face contacts were done. Those were people who showed up for their test, whether it be a breath test, a urine test, an oral swab. There were 7,498 face-to-face contacts that were scheduled for people to come in, meaning their color was on the machine and we were expecting them to show up. 1,727 of those failed to report. When somebody fails to report, their referral source receives an incident report, and depending on who that referral source is, that those no-shows are handled then, whether it be by the case manager, the pretrial person reporting in, the probation agent, whoever asked that person to be tested gets notified. Same thing if they come in and their test is positive. Positive is not a good thing in day report. We want their tests to be negative. And so all of the positive tests are reported to the referral source as well. Anyone better off? Up above, we put in the total number of tests completed. Now you say, why, how could there be so many tests? We test for multiple things. Sometimes we have a 12 panel for our treatment court people that test for 12 different substances. We have what's called an ETG test, which is a urine test long range for alcohol, more effective than the breathalyzer. That's why below we have the two broke out. We separate the breathalyzers from the urine tests. It's definitely, the breathalyzer is not as effective, and because it's a certain amount of hours that it will detect it in your breath. And that's why we also utilize the ETG on a random basis, because those are more expensive than a tube and a breathalyzer. But so we mix in those urine tests. Our treatment court participants are getting a minimum of 3 tests a week. So you can see there's 23 very small amount of breathalyzer, although we did have somebody come in 2 weeks ago at 0.33, so on a Friday. So it does happen, but that's why those urine tests are added in as well, to make sure that they never know what they're getting tested for. They get their color and they come in. So that's pretty much day report. It's been around since 1994. It's been a lot of the other counties are jealous of our ability to do that testing. It's difficult to have that availability on holidays and weekends, and it's not like they stop using substances for those occasions. So I think you close out.
Is this you or me? Is it you or me? Yeah, you go ahead.
Oh, sorry. Almost took off with this mouse. All right, this lives here. There we go. Thank you. So to wrap this up nicely, because again, I know we have another wonderful presentation that you can look forward to, but basically to wrap this up with a nice little bow, is our work done? Absolutely not. These are conversations that are still ongoing. Right now, we took a look at addict-specific justice programs from specifically 2024, but right now I'm building 2025 kind of in Power BI, these reports that you'd be able to filter by month, by program, by case manager. So we're working on trying to make that more available, more accurate, and timely. And we're taking this traveling roadshow to all of the departments, but again, starting with the justice programs. And when I do work on different projects, what my hope is to be able to leave each department with tools that they can use to have those better conversations, to dig into what the data looks like with as little delay and in the highest accuracy as possible. So I'd be remiss, I'm just the facilitator, but I'd be remiss to not thank all the people that it really does take a village to do something like this, from the administrator who's driving the vision and being able to make sure we have the buy-in from the stakeholders. If we didn't have that, we wouldn't get anywhere. So thank you. Laura Yari, to be able to talk about a lot of these operational challenges that we have in these programs and be able to show the data, the good, the bad, and the ugly. And the case managers at ADDIC to work with me and change the way that they do things on a daily basis in order to get this information to you all as soon as we can. And again, it's not perfect, but we're getting there. We're making some good progress, and we're trying to get this in front of you as soon as we possibly can, again, with respect to that availability, accuracy, and timeliness. And last but not least, just thank you so much for having us and for your time and attention. Thank you.
Well, thank you, Laura and Michael. Laura was explaining to me before the meeting the work that went into doing this, and my head hurt. She never finished, but yeah, it took a tremendous amount. Your brain is amazing. Thank you. Okay, does anyone else have any more questions or comments? Okay, we're going to move on to 7C, and we have Krista Jensen here to give us an update from Social Services on truancy mitigation efforts. And thank you for enduring all of this. And Nick, you're getting baptized today.
All right. Well, good afternoon. It was interesting to hear anyway, so it's good to sit through. In your packet, you have a memo that I've put together that talks about truancy and the role of social services in truancy. And so I will not read it verbatim for you. You'll have an opportunity to review that, but I'll give you a brief presentation so we can try to get moving on to the rest of your days. But essentially, social services in Marathon County, we do play a role in addressing truancy within the county because we're focusing primarily on those habitual truant youth as defined under statute. So that's our mandated responsibility. Additionally, we do provide financial and coordination support for truancy diversion programs that happen in our local schools. And so with that, we have distributed approximately 35 slots. And what slots means is that's 35 different students at any given time who can be receiving truancy diversion services. And those are broken up into different schools that receive a different number of slots. And that's identified within your memo here as well. So social services provides that, but schools may opt to fund additional slots independently. Mosen East School District has done this. They directly contract with the contracted provider, or they can create independent programming to address specific needs of their schools. We do have some schools who have hired on individuals to help to support this at their local school level. So I do think it's really essential to recognize that truancy is classified as a status offense, which I'm glad the DA and our other attorneys are here to answer any of those legal questions, meaning it's not considered a criminal offense if it was if it occurred by an adult. So research has consistently indicated that addressing the underlying causes of these status offenses outside of formal youth justice system yields more effective results. We hear that with Laura's presentation and really trying to do all the diversion, what we've seen with the district attorney's office, and that's essentially what this is. We're just talking about youth instead of adults. So under the statute, it establishes that how we run our services, what are mandated, what are not mandated, and also establish what must happen with truancy in the county. So Statute 118 really talks about this, and this is again in your memo, and it talks about that we have to have a panel and we have to have a truancy plan. That must meet biannually, but Marathon County is meeting about 1 to 2 times a year. So we're meeting more frequently than what we're required to by statute to make sure that our truancy plan is up and running really well. That statute also talks about what schools are required to do before referring a youth for habitual truancy. In order to be considered a habitual truant, you must miss 10 or more days a semester. That could mean that the student is in school but not going to class. So they might be in the building but not at math class. That would be considered an absence and part of truancy. So schools have to notify parents or guardians about the unexcused absence, and in the memo you'll see the specific statute where it shows A, that's like sub A under section 118. So I'm not going to read that to you specifically, but they have to notify parents or guardians of those unexcused absences, and then they also have to implement interventions to engage a student and address the barriers of their attendance, and then document those efforts before they can make a referral. So in Marathon County, what this looks like at the school level before it becomes a referral for truancy citation or habitual truancy is we have attendance correction committees. That's something the schools have done. The district attorney's office was very involved in putting those together, and social services, and we're a part of those. So when a student begins to show signs of truancy, they're then brought before the school's attendance correction committee, or ACC as we call them. Those are school representatives, social services representatives, your images, invested community partners. If you all were interested, you could sit on their attendance correction committees, and they really work to talk to the youth and the family about what's going on, what's prevented you from getting to school, how can we incentivize you getting to school, do you need any sort of mental health or aorta resources, all of those different things. So again, exploring that underlying cause of what's leading us not to attend. If they're not able to modify their behavior through those attendance correction committees, a referral may be, but is not a must, it may be made for truancy citation court. Truancy citation court relies on the district attorney's office to impose different sanctions and talk about what that can look like. So as far as I understand, those are things they can talk about, curfews, they could reduce the use of their cell phones, different things of that nature. Anything else you want to say on that? I'll pause there for a second.
No, it really is a collaboration with the school. We really rely on the schools because they know these students, they know the things that have already been tried with the students. So we really rely on the schools to kind of guide us in what we recommend to the court and what to do. So it really is a school-led initiative.
Yep. And so if they're, go ahead.
Now, they're referred to you, are the parents involved, or are they kind of just let them do what they want? I mean, I'm just curious what the parent status is when children are doing this.
It depends a lot. We'll see a case where maybe the parents aren't involved at all and don't really care. We also see cases where the parents are very involved and they come to court and they say, Judge, I try and get the kid to go to school. I go in there and try and wake him up every morning. He refuses to go. I can't force him to go. I need help. So it really is a gamut of everything. There is a way if, for younger kids, where if the parents are the ones that are really causing the issue, there is a separate route that the parents can be held accountable for contributing to truancy. We use that a lot more with smaller kids, where it's more it's the adults that are causing the problem, where we do it less when the kids are the ones that are causing the problem and aren't going, but the parents are actively trying to get them to go. So it runs kind of both ends.
And we'll talk a little bit more about what some of those efforts can look like as well. But just to share about how truancy is funded and how truancy diversion is funded are a little bit different. So historically, truancy intervention in the diversion program has been funded through grant allocations and through tax levy through social services under our annual budget. So we receive grant funding through DCF, the Department of Children and Families, with the Community Intervention Program grant. We use that at social services in 3 different ways, which are for our intensive supervision services, restorative justice initiatives, and this, truancy intervention services. So we take that grant and we split it out between those different pieces. So that's about 15% then of our truancy diversion services are coming from that CIP grant that I just shared, and then 75% is coming through tax levy under the social services budget to support this. So while we're mandated to serve youth who are referred again for habitual truancy, there is no state requirement for counties to provide truancy diversion services beyond what's supported for our available funding and what the county board identifies as a priority. So how this truancy intervention program works is that we subcontract with Mirror Image, who is a local company. Again, they're given those specific number of slots that they can utilize to assist those students who are struggling in showing up. And they do a variety of different things. So they'll meet with the youth and families to help understand what those barriers are. School will call before 9 a.m. and let them know, hey, I have these 3 youth who aren't here, and then the Mirror Image staff are going over to those youth's home, and they're trying to understand, why aren't you at school today? Do you need transportation? Helping to get them motivated, all of those different pieces. They do attend the truancy citation hearings if it gets to that point, and then help to address any of those additional family needs and attend those attendance correction committees. They may not be working with a family who's in the attendance correction committee at that time. It might not be an assigned slot to them, but they're still there to provide ideas about what has worked for other students in order to hopefully prevent them from having to receive that next level of service. So these show the slots that are made up on the screen here and who sort of makes up those different slots. There's been a lot of different strategies over the years. In 2023, we moved more slots to your junior and your middle high students than we had with your high school students, because we were seeing that you really have more bang for your buck if we can get them younger and on board than we were seeing with our high school students at that time. Doesn't mean that they don't still have slots, we just provided more to junior and middle high school students. And then last year in 2024, we were able to provide additional slots to our schools because we removed some of the funding that had been previously used for electronic monitoring and drug testing. District Attorney can probably speak to this, but those are not components under truancy diversion that we are actually able to statutorily utilize before they get to the point of a court hearing. So we took out that from the budget and we added additional slots in for the diversion component that still exists for the habitually truant youth that we're mandated to serve. So you can see that Wausau West has 4 slots, John Muir has 6, East has 4, Horace Mann has 6, EAA has 1, DC Everest has 6, and junior high has 8. So a big question is, how many students does this impact? What's that number really look like? So through the diversion program contracted with Mirror Image is last year in 2024, they served 49 unduplicated youth. At that time, there was 25 slots, so that just shows, right, they use their 25 slots, but that's obviously more than 25 children because they have 25 at any given time. So 49 youth were served last year. How many youth went through truancy citation court with the district attorney's office leading that? In 2019, it was 109 cases. 20 and 21, we had COVID, so that's no data available. And then in 2022, there were 12 cases, 23, 54, and in 2024, I didn't have it at the time, but now I do, that is 45 cases. So you can see with the implementation of the attendance correction committees, there was a significant change in the amount of time that was taking our district attorney's office and the amount that were being referred to truancy citation court. This 2022 number here is a little throw off, but you also have to remember that the PHE ended in 2022. I want to say maybe May of 22. So we also had some COVID pieces coming off of that, which is also evident here where we talk about how many youth then actually came through for mandated services being habitually truant. In 2022, social services had 15 habitually truant GIPS petitions. In 2023, we had 2. Again, you have COVID. And then 2024, we had 12. So that's a little bit about how truancy both on the diversion side and the habitually truant, is facilitated here in Marathon County. Social Services is committed to fulfilling our state mandated requirements, which go back to the habitually truant youth, and then aligning whatever priorities our county board sets. We're going to continue to collaborate with our schools. We've really increased collaboration, I would say, the last few years, having regular meetings about students and behaviors that they're struggling with being a part of the attendance correction committees, and then partnering with our community to make sure that we have the right interventions in place at the right time for the families, to help prevent not only the attendance challenges, but we know typically when there's attendance challenges, there's other challenges happening in those families, and we want to try to help to address those when it's mandated, when it's a priority from the county board.
Jason?
How do the rural schools deal with the truancy? Because I didn't see a lot, like Colby or Stratford or Abbotsford. I'm just curious.
Yeah, so rural schools, they can establish their own attendance correction committees as well. We don't have the funding to support them specifically from social services in making the referrals to Mirror Image through this program, but they could opt in on their own to utilize their own funding to do that, just as Mosinee School District has, or to bring in in-house staff maybe to address those concerns, use their social workers and people of that nature.
How are students that are over 18, are they are they handled the same way because they're not minor children anymore? I know there are 18 and 19-year-old kids still in school. So where do they fit in all this?
That's a great question. So juvenile justice is addressing youth 17 and under. District Attorney, do you have any insight for 18, 19-year-olds attending school?
I know there is a law on compulsory attendance, and it might, I'm not sure where it ends. I think it ends at a certain point where if you hit a certain age, you can't be forced to go to school anymore. And so if that's the case, and I can look it up, I'm not super familiar with that law, but once they hit that age, then truancy wouldn't really apply anymore because they're not required to attend.
Similarly, we're talking really young, but kindergarten, right? Kindergarten is not mandated to attend, and so that comes up sometimes for folks as well.
Nick?
So I guess my question is with respect to the allocation of funding. So it looks like the CIP grant, it covers the 15% and the county levies at 75%. I guess my question is, why isn't the proportion amount covered by the CIP grant a lot higher than the amount ultimately being passed on to the county and its constituents?
Great question. Should be directed at your state legislators for why they choose to fund what they choose to fund. The grants we get from the state are just that, grants from the state. County tax levy is county tax levy. I would love to tell you, and this is foreshadowing your next item on your agenda, which is what do you want to talk about next month? Next month, you're going to need to talk about what role, if any, you want to take in terms of advocacy with respect to the state budget. This is the state court system. We are in a state courthouse. They do a great job of paying 100% of ADA salaries. They should be paying 100% of victim witness salaries. They should be funding their court system 100%. This partnership is not the county is left using levy to fund state mandates. That's not new. You'll hear that. It's one of my stump speeches. But the short answer to your question about truancy is the same answer. It's a some certain allocation from the state of Wisconsin that comes to Marathon County. We choose to allocate, like Krista said, we allocate a portion of that grant to a number of priorities. But at the end of the day, I would love nothing more than to turn around to the county board and say, this is wonderful. The state of Wisconsin is fully funding all of the things that it mandates us to do, but then also all of the things that you as the county board want to do. I don't anticipate being able to make that speech. Because there's a lot of good things that we do, not enough funding to fund them all. But at the end of the day, if the state increased the allocation to address truancy, we would do more to address that. Or we would take the county levy out of that and do something else that the county board wants to do with that levy fund. But the state allocation is insufficient to change that percentage. Kyle's got something.
I found it. It is up to 18, so you are required to go compulsory through 18. So services wouldn't be able to do the diversion programs at that point, but I believe they'd still be able to go through the truancy citation process through the county. If they're at that 18, would 17 be able to?
Under
Under
17.
Okay,
So 17 and 18 would, the only option would be the citation through the court system for those 2 years.
Any more questions for Krista? No? Okay, thanks a lot. That was
Thank
really
you.
interesting. Thank you. Okay, we'll move on to number 8, next meeting date, time, and announcements and future agenda items. Of course, the committee is always asked to bring ideas for future discussion, but there is one coming up, discussion of state funding for court operations and consideration of resolution to increase state funding for circuit court and justice system operations. You have something to say for that?
I anticipate that being a significant discussion. So you heard from DA Mayo a while ago about the Justice Coalition and their proposal. So that's what that item is to allow you to talk about, is what role, if any, the county board wants to take in terms of advocacy at the state with legislators and the governor and the Joint Committee on Finance. Similarly, the Wisconsin Counties Association, if you've been reading the magazine, so you would have seen some of those legislative priorities. So your next meeting, I think, is set up well in terms of timing. If you want to play a role, you kind of have to have that advocacy done while Joint Finance is doing its work before a final budget is arrived at. With, I think, the goal for that final budget is always about July. June, July, to have that thing tied up pretty well. Doesn't always happen that quick, but Joint Committee on Finance, if you do want to influence that, that's why Madam Chair put that on the agenda.
Okay. All right. Next meeting, Tuesday, April 8th, 2025 at 1:30. Where your depends. I'll take number 9. Jason, or need a second? Deb, all right. All in favor of adjournment, say aye. Okay, opposed? Meeting adjourned. Thank you, everyone.